So we actually have Zika in the United States now from travelers who've been in countries that have mosquito-borne transmission. People have become infected and have come back to the U.S. So the problem actually is here. Hundreds of cases in the United States have been diagnosed. And I think this is a lot more apparent to people for Zika than it is for some of the other viruses where the same thing happens, chikungunya. Most people probably haven't heard of chikungunya, but the same thing is true, that it's not transmitted by mosquitoes in the United States, but there's a lot of travel to places where the virus is transmitted. So the first thing is to know where those places are, and for people who are pregnant or who might be pregnant to not go there. I think that's another aspect of Zika that, at least from a communication standpoint, is challenging, that most of these emergencies that we've talked about, people are dying, and in the case of Ebola, there's this long history of people really fearing the disease. For Zika, we're kind of in the opposite situation where we have not thought there was a serious problem, and for adults who aren't pregnant, it's not, in general, it's not a serious problem. So it's a very specific risk group, which is pregnant women and their fetuses and their babies. So there's sort of a narrow zone for disease that, for the most part, is not something that would be of huge concern, where there's just tremendous concern because of this very severe birth defect. So for the Olympics, the guidance really isn't different for the Olympics than it is for other travel, that people who are pregnant or who might be pregnant should not go to places where Zika virus is being transmitted. One fortunate occurrence, because Rio is in the southern hemisphere, the time of year that the Olympics will take place will be winter there, so there will be fewer mosquito-borne diseases just in general. So it's actually it will probably be the low season for Zika. It is for dengue. So that's kind of on the plus side. Just really complete luck that the Olympics happen to be in the southern hemisphere this year. So the main risk is to pregnant women or women who might be pregnant. The overall travel to the Olympics, even though it's a lot of people, it's a pretty small part of all the travel to a very small part of all travel to Zika areas. So we are not, the risk to the rest of the world, we don't think is especially being increased by the Olympics.